I'm Vanessa Kortge. I'm the Director of Marketing with Lamprey Healthcare, and I'm sitting here with Ann Peters, who is the CEO of Lamprey Healthcare, and Mariella and Durso, the site administrator of our Nashua Center. Ann, tell us a little bit about Lamprey Healthcare.
Lamprey Healthcare is New Hampshire's oldest and largest community health center. We have 3 centers, the center here in Nashua, and 2 others, one in Newmarket and Raymond. And we take care of about 17,000 people a year and about 5,400 patients out of our Nashua Center. We're a community health center, and community health centers really focus on primary care and access to care, prevention, giving people health education and the skills to be able to manage their lifestyle for healthier outcomes. And we try to remove the barriers to care, whether they're financial or cultural or transportation or a whole host of things. We really focus on people who have difficulty in access, the uninsured, the indigent, and those who have a lot of barriers to care.
Great. Mariella, as the site director for the Nashua Center, what have you seen happening at your local center?
Well, the Nashua Area Health Center has been a comprehensive, family-oriented health center for 11 years. And during the last, probably since 2008, we've had a 27% increase in volume. We're seeing more and more young families and more people that have been impacted by the economy coming to the health center for primary health care services. Many times they were employed and may have had insurance, and then they have lost their insurance, so they come to us seeking primary health care. And we're there to help them, and we help all ages, all incomes, regardless of their ability to pay. And we're there, we provide primary health care, we have pediatric, adult, OBGYN, and we have a lot of supportive services such as chronic disease management service for the diabetic, or substance abuse counseling, nutrition counseling, case management, things of that nature that kind of help people through this time frame.
And with you serving the uninsured, the medically underserved populations, what are some of the impacts that you've been seeing from the economy at your center?
What we've been seeing is a growth in our people who are eligible for our sliding fee. When you come to the health center, we have staff called patient advocates that meet with you, and they'll work with you to find out what your particular barriers might be in getting primary care. That could be financial barriers, that could be language, that could be transportation. And so looking at that would respond to what your needs are and then create a plan to try to help you address those needs.
And you have some exciting events coming up.
Yes, we're happy to say that we've been searching for a new site because due to our growth, and we hired some more primary care providers, we needed to grow because we needed additional space in order to meet the needs. And Ann and myself and other staff have been looking for a number of years, and in the last year have been busy building a new building. It was the old hospice, home health and hospice building on 22 Prospect Street, and we'll be having our first day on October 17th, which is quite exciting. There's additional exam space and additional space to register people and provide services. So it's really an exciting time for the staff at the health center and for the community.
Great. Now, Ann, I understand that we have a community capital campaign going on.
Yes, as Mariella explained, we did we pulled a lot of staff together to write a variety of different grants and applications, and we were able to secure, we were one of 80 in the country that got a federal grant for facility expansion in the first round, and we also have received significant support from the community. Southern New Hampshire Medical Centers gave us a lead gift, And right now we have about 10% left to raise. And so we've been awarded the business tax credits, and we are now out to raise that last $530,000 that's left for completion of the campaign. So it's a really, it's an exciting time. And to be able to, as Mariella so nicely said it, to have a building that allows you to not be so overcrowded, and to have the professionals have the office space and the exam room space that we need, and then to be able to grow to meet that need is really exciting. So we're off on our capital campaign to raise the rest of that money.
Well, that sounds great. I hear that you have a video of the campaign, so why don't we take a look at that?
The faces of Lamprey Healthcare. All extraordinary people making life better. Since opening its doors nearly 40 years ago, Lamprey Healthcare has grown into a nationally recognized model of everything a cost-effective, efficient, and caring medical home should be. Its mission has always been to provide high-quality medical services to underserved communities. A decade ago, Lamprey brought this mission to Nashua.
In 2000, we were asked to come in and assist and take over the financially troubled neighborhood health center. Our board supported us in this, and we also had the support of the hospital, and even more so the greater medical community.
Nashua has grown and changed in significant ways since 2000. And Lamprey has become a safety net for patients, and a resource for both the medical and business communities.
Well, the underserved population as far as health care now includes the families that have been here for generations to families that have just recently moved here.
This is a true medical home in every sense, for babies, children, teens, adults, and seniors. 58% are uninsured, and without Lamprey, the emergency room is often their only alternative.
And I believe that everybody should have a medical home. The emergency department is not a medical home. It's more for people that have urgent illnesses. But people need to have a medical home where they get their primary care, or in the Nashua Center, it's where they may have prenatal care, develop a relationship with their nurse midwife or an OB physician or family practitioner.
So here's your baby's hips.
Patients come to Southern New Hampshire through Lamprey's system because our hospital is able to provide a higher level of care with our neonatal intensive care unit. Also, through our residency, we're able to provide them OB/GYN care.
The Nashua Center offers much more than OB/GYN and primary care. Services such as diabetes management, substance abuse counseling, health and nutrition education all help people stay healthy. Lamprey's multilingual staff serves a culturally diverse clientele.
A lot of people feel more comfortable when they have somebody here that can interpret for them in their own language.
This takes a different kind of healthcare provider whose sole purpose is to reach out to people and give them the best care they have. This is not a for-profit entity. It's not about money. This is about service.
And it's a service that Nashua businesses rely on and benefit from. It's a resource that needs and deserves community support.
So we have to make sure that we find a way to support it in any way that we can, whether it's partnerships or real dollars, to make sure that that medical home that people have found stays in our community.
The Nashua Area Health Center plays a very important role in our community, providing health care to the uninsured. And it's an important thing for employers because if the employees get good health care, they're going to more apt to show up for work rather than being in the hospital.
The Nashua Area Health Center is bursting at the seams. It's beyond capacity right now, and the numbers continue to grow.
During the last 2 years, we have grown 27% in patient volume. We are needing additional facility space to meet the unmet demand.
We're very, very excited about the new building. We're terribly overcrowded now. We serve well over 5,400 patients in a given year here. And the new building, which is only a couple doors down the street, it will be a wonderful opportunity to meet that growing demand.
You know, it's almost to the point where people take for granted that it's going to be there. Which
it takes care of people who otherwise would fall through the cracks.
The Lamprey Health Center sees patients from all walks of life.
I have to tell you, I think it's one of the most well-run organizations I'm involved with.
Thanks to strong community support, Lamprey Healthcare provides a solution to rising healthcare costs. A medical home where people from all walks of life get the primary care they need and the tools to live healthy lives, paid back many times over, to the benefit of us all.
Well, Anne, you can clearly see the need within the local community for the new building and for the capital campaign. Tell me, why is it important for the Nashua area to have such a valuable resource?
Well, as you heard Mariella say, the majority of our patients are either do not have insurance or are indigent, and they need a lot of the other services that help them get access to care. And this is primary care with our physicians, our nurse midwife, our nurse practitioner, and it really is the access to the healthcare system. Mm-hmm. So if people can establish a medical care home where they have access to their medical care, they have services that teach them how to manage their chronic condition or prevention, then they're less likely to use, first of all, they have much healthier outcomes when they become engaged in their care. Mm-hmm. And then secondly, they're much less likely to use the ER inappropriately, we also can keep them out of the hospital by managing their chronic disease. One of the things that the services that community health centers have is services that provide access to medications. We have a medication assistance program, and we overall Lamprey Healthcare provided access to over 600, well, in Nashua, $600,000 worth of prescription assistance last year. And just by removing that barrier and allowing people to be able to get their prescriptions filled, then they're much more likely to follow through on their care and not be making choices between food or their medicine.
Mariella, this sounds like a huge task, providing a solution to what is a significant healthcare problem. How do you work within the community to help do that?
I think the value of a community health center is the health center kind of takes on the unique qualities of the particular community that it serves. Mm-hmm. For example, the Nashua Community Health Center, it has people of many different backgrounds. We serve many people that speak different languages that are new immigrants maybe in the community, or we serve the refugee population. We also serve people who getting care at a traditional primary health care setting may not just be an easy task for them to achieve, because we have particularly services that they need that influence them being able to get over the barriers that they typically might have. many of the staff at the health center are actually live in the community, and they serve the community in that way where many of the patients and staff know each other. We also work very closely with the community agencies and different healthcare entities, and in the Nashua community, they're very receptive and very supportive of the health center. For example, we work with both emergency rooms, and we hold slots in the family practice provider's book to serve people who were seen in the ER that need a follow-up visit that don't have a primary care provider. And then we're their primary care provider for as long as they would like us to be from that point forth. And over and above that, we give family-oriented primary care. So say we take care of an individual in the family that went to the emergency room, and they had many other people that were in their family that didn't have primary care. We would take all their family members. So we get to know them, and when you get to know a family and understand what their healthcare needs are and what their barriers are, you can begin to support them so that you can get better health outcomes down the road. We also have a number of collaboratives, like we have a 4th site in the Greater Nashua Mental Health Center, and we have a nurse practitioner providing primary care right within the mental health center to the severely and persistently mentally ill. We work very closely, take referrals from the health department, from various community agencies, so we're pretty integrated in the community.
Oh, that's wonderful. Now, with this new center at 22 Prospect, you're opening Monday, October 17th, right? Yeah. So what will that new center allow you to do that you can't do now?
I think specifically because of the way we've grown and changed, the physical space configuration is more conducive for access. So for example, right now we have 1 window to check somebody in. In the new facility, we'll have 3. We are physically set up a little different, and we have 3 interpreters on staff. So they're going to be physically located so they're more easily accessible for the providers and nurses to ask their assistants to have a visit with a patient or have a follow-up appointment. We also have additional exam room space that will just allow us to take more volume. So I think the biggest issue is it helps us increase access.
Wonderful. And is there anything that you would like to say to the community that's out there about how they can get involved, being a part of your mission in expanding access to care?
Well, if they know of someone who needs access to care, to call the health center. If they have access to the internet, it's www.lampreyhealth.org, and that's our website, and that gives a whole host of information and background. I do want to say that we wouldn't be here today if it hadn't been for the community of Nashua helping us along the way, and very specifically the greater medical community, because we're primary care and we do a lot with prevention and education, but our patients do need hospitalization, they do need access to specialists and diagnostic services, and it's the greater medical community in Nashua that's really stepped up in that regard, and we're extremely appreciative because it allows us to do what we do best.
That's great.
And a good example of that is, like, we have the OBGYN residency from Dartmouth on site, and that they support prenatal care and GYN care and high-risk prenatal care. We're very fortunate to have that in community, and as Ian mentioned, if we need a subspecialty referral or we need a resource in the community, it's very easy to get support in this community. We pick up the phone and we call, and everyone is always receptive, and they help us take care of this community, and that's we're very lucky for that.
Absolutely. Great.
And the mayor has been very supportive, very, very supportive, as is the health department. I think you have to work very closely together so that you're both able to get your mission and tasks done.
Great. Is there anything else that either one of you would like to say?
Just give us a call, and for those patients who do already come to us, we're just down the road, a couple houses on 22 Prospect Street.
Great.
2 houses down on the same side of the street.
Now, will you still be called Nashua Area Health Center?
We're going to be called Lamprey Health Center, and we'll be the Nashua site because there's a Raymond site and a Newmarket site.
Of course.
And so we'll be using that name, which we're happy to use. And being part, it's been wonderful to be part where you have 2 other health centers because you get to share and learn a great deal from each other, which is another value that we have.
The other thing that it really has done for us is by having all 3 centers, we not only share and learn from each other, but we have efficiencies that are just not possible when you're just one. I mean, we can centralize HR, human resources. We can centralize purchasing. We can centralize billing, and all of that. And all the community health centers in the central and southern part of the state have joined together to have one health information network. And that's allowed us to, again, have the efficiencies, because every dollar that we can save in the delivery of care allows us to serve another patient. And our goal is to meet the need. So we have to not only work hard, but work smart. And again, it's not something we do by ourselves.
Right.
It's with the community support that we've received.
Of course. So anybody within that community, if they're already a patient, your phone number stays the same. So if they have questions about the move, they can call you at 603.
883-1626, and we serve the greater Nashua community. So it's Nashua and the surrounding towns.
You want to say that number one more time, Mariella?
883-1626.
Okay.
Yep.
Perfect.
So.
Great. Well, thank you for joining us today.
You.
And good luck with your move.
Thank you. It's very exciting.